We're going to take you now into an operating room to show you one of the most incredible medical procedures you've ever seen. A technique performed by surgeons with drills, wrenches, and hammers, common tools that can produce uncommon results, adding 3 or 5 or even 12 inches of height. And can you imagine what that would mean to someone 4 feet tall? It's a story that generated quite a reaction when we first told you about it. Here's Dr. Timothy Johnson with a medical miracle that is changing the lives and limbs of patients of all ages.
Oh, let's go take a bath.
Almost 2 years old, Kelly Lockett is an active and happy child. The Arizona toddler is like every other child her age, with one obvious difference. Her lower right leg is flesh and blood and metal.
When we first had it on, we were oh so careful because it looks like something out of Star Wars. Then we found out she would take falls and just get right back up, dust herself off, be right at it again.
Kelly started wearing the metal contraption 5 months ago. It is an essential part of a controversial medical technique known as limb lengthening. Doctors using this remarkable procedure can coax new bone to grow and can reshape severely damaged limbs.
Kelly, where are you going now?
Today, Kelly zooms around easily, maneuvering with the brace. It is a far cry from the life her father Jim thought she might have to live.
After she was born, they set her to the side, and I went over and counted the toes, and it just was a horrifying type of experience. It really was.
Kelly was born with 4 toes on her right foot due to a birth defect in her lower leg. Her leg was also short and bowed, and the small bone, the fibula, was missing. Carolyn Lockett was stunned by the doctor's initial recommendations.
There were actually 2 doctors. One leaned towards amputation, the other one said definitely amputate.
Doctors recommended amputating and using an artificial limb to correct a severe length problem. But the Locketts would not accept that. By chance, through a friend of a friend, they learned about the Maryland Center for Limb Lengthening and Reconstruction here in Baltimore. They entered a world of patients like Kelly, being treated for birth defects, injuries, and other conditions in which one limb is shorter than the other. And all of these patients were wearing a bizarre metal scaffold with wires and pins penetrating their arms and legs. The Locketts met Dr. Paley, the co-director of the center, who offered them something no other doctor had: hope.
He said her leg was very reconstructible. He also gave a very specific treatment program and time frame in which to do things. And that was very comforting.
To date, Dr. Paley's clinic has performed over 3,000 limb lengthenings. He is only one of a handful of American surgeons doing the procedure full-time.
Most surgeons are aware that limb lengthening can be done. I don't think that most surgeons are aware of how good the results are, and that even for the complex cases, how good the results can be.
Dr. Paley showed me how limb lengthening works to correct deformities.
The bone is crooked, and then as we lengthen on this rod here by turning this nut here on the rod, the bone gradually gets straighter.
This is the same technique used to correct Kelly Lockett's leg. The other extraordinary effect of the procedure is the actual lengthening of her bone.
This is Kelly's original x-ray, and you can see she has about a 3-inch difference in her leg length to start with.
The concept is simple. A very small turn on the device 4 times a day slowly pulls the bone apart after it has been surgically broken. Because bone is a living tissue, it naturally generates new bone during the pulling process.
These 2 points where my fingers are pointing were once together and then were pulled apart gradually. All of this stuff is the new bone that is growing.
Our cameras saw firsthand how the apparatus is applied. The procedure is performed with simple tools: drills, wires, pins, a wrench. In this surgery, Dr. Paley and his team will operate and apply the device to lengthen a femur, the thigh bone, while the patient is under anesthesia. First, wires are drilled through the skin to mark a place in the bone. The whole procedure is monitored by X-ray.
Come a little towards me.
Dr. Paley carefully examines the position of these wires.
So the wire allows me to choose a very precise location. If I don't like it, I can take a wire out. It doesn't leave a very big hole.
The wires are then replaced by threaded pins.
So that is the first cluster of pins.
The threaded pins are drilled through the limb in 2 places, above and below a point where Dr. Paley will actually break the bone.
Okay, bone cutting time. Shoot.
Here, like a surgical carpenter, Dr. Paley hammers through the bone.
It's broken. You can see that it moves now.
The threaded pins attached to the broken bone on the inside are braced outside by the device, which secures the bone while it heals.
The external device, in a way, is like a scaffold. It stabilizes the limb. It actually allows you to walk on the leg while it's all happening, and it's keeping the two ends apart.
Let's lean back.
The patient adjusts the device a millimeter a day, so that in about a month, they've lengthened just a little over an inch.
And last one. You're being such a good girl.